here with Dr. Megan Shiga at the Dentistry of Chagrin. She's my favorite dentist in all of Chagrin.
Thank you.
Megan, can you tell us a little bit about your history and how you got to this location?
Sure. Well, I went to dental school at Ohio State, and then after I graduated from dental school, I went and worked in a larger group practice, and I figured out that I wanted something smaller, that it would be more personable with the patients, and I'd know everybody. And when my dental headhunter found Dentistry of Chagrin for me to purchase, I jumped on it because I knew I love the location, and it just
there's something about Chagrin Falls, I think. So what would you tell me is like one big thing or more big things about how your practice differs from the others? Because I know it does. It's very, I don't know, it's relaxed, and
we try as much as we can to make people comfortable. And also, I really care genuinely about everyone. I know everyone says that, but I really feel like I do it, and I hope that
it comes across.
Yeah,
it really does. She always has a smile on her face, and she's an awesome person in her own right. I know you've had a couple of kids while you've been, practicing here.
3 girls, and it's so nice. 3 girls.
I thought it was 2. So you sneaked out one time when I wasn't here.
I know, they are all real close together, so it's hard to even. But they're wonderful, and that's one reason that I love dentistry, because I can have my Friday where I'm with my kids, and they're at school, but I'm here a lot, so it works.
It's a very comfortable environment for you to have a family. So how many people do you have coming to your practice now?
Well, we have about 1,400 active patients. Wow. I know, and a day-to-day amount of patients that come in is different, because on Mondays we see just hygiene, and we do 3 columns, and then I just do exams. But we're here till 7 p.m. to give people that are at work time to get in to get their
That was one thing I really appreciated when I had a full-time office job, because you can't always come in the middle of the day, or at lunchtime, or whatever. Do you have like one unusual patient or situation that you can share?
Well, that would take me back to the dental school.
Okay, let's go back to dental school.
There were a couple of people may think this is kind of gross, but things that stick out in my head. One day I was working in an emergency clinic, and I realized how a tooth can be life-threatening. There was a man that had his whole jaw was swollen, and then through his neck was swollen as well, and it was about to cut his airway off. So the resident that was overseeing all of the students immediately went to him and actually did an extra oral drain. And usually you do those in the mouth. This one went right into the infection. So I'll never forget that. And then one other story. I was on Ohio Project, which is where the dental school sent us out to remote areas of Ohio. And there was a man with a loose-fitting denture. And he took it out, and he said that he had helped fix it by using bologna.
That is interesting.
Those were the 2 things that stuck out in my heart.
I can imagine why.
Yeah.
But all of this tells us that there's a very good reason to see your dentist very often to make sure those things don't happen.
Right.
So, what would you say, or do you know of any new things that are coming in the dental industry?
Well, the things that are so cutting edge is the intraoral scanning, which has been out for a while, but it just keeps getting better. And the milling units, the dental lasers, you can use it on hard tissue or soft tissue, and not use local anesthetic. And then I'm very curious to see how stem cells playing in
Oh
dentistry
yeah,
in the
you
future.
hear stem cells in
Mhm.
every direction.
Lots of research going on, and
Yeah.
can't wait to see what the future holds.
It's exciting.
Yeah.
It
Mhm.
really is.
Yeah.
Well, I really thank you for taking the time with me.
Oh, thank
And
you.
I'm going to put all of the information about Dentistry of Chagrin on the website so
Okay.
that people can access it. And you're okay with getting more patients, even
Yeah.
more than you have?
Yeah.
Okay. Well, thank you, Megan. It's been a pleasure talking with you.
Thank you so much.